13 consecutive days of double-digit increases, health authorities now question whether Victoria is in the midst of a second wave.
Whatever you call it, it's as big as the first one. It's looking that way. Second peak, second wave, it's got the same challenges.
The last time the state recorded a daily increase this big was at the height of lockdown restrictions. The latest tally, the highest number of locally acquired cases so far.
Obviously, we're concerned by the increasing number and the upward trend, and we're monitoring the situation very closely.
Australian Border Force at Melbourne Airport shut down after a positive test. 6 schools now closed as a result of outbreaks. The Prime Minister saying the entire nation will pitch in resources to help contain the spread.
We can marshal those resources across states and territories and get them to where they're needed in Victoria right now.
But not everyone's convinced it's a second wave.
The label is less important than the actions we take, and the actions we're taking are really positive to containing the further spread.
One action includes a new, less invasive saliva test. 87% effective and more appealing than the nasal swab.
The gold standard, of course, is a throat swab, but we do believe that this certainly plays a role. Much better to have this done than to have no test at all.
Around 30% of returned travellers are refusing. Changes to legislation will require them to take the test or spend an extra 10 days in quarantine. Those in Melbourne's Ridges Hotel raising questions about hygiene conditions, with one guest claiming to have been bitten by bed bugs. While the Surgeon General of the Australian Defence Force inspected a Melbourne testing facility today, operations mostly in order, as 13 ADF personnel take an average of 500 samples a day. The results of this 10-day testing blitz will inform Victoria's next step in its COVID-19 management, with the option of locking down suburban hotspots still very much on the table, with predictions the outbreak will get worse before it gets better.
What we're seeing is transmission across settings because people are still going out with symptoms. So whether or not it needs a legal direction, I think, is a conversation to be had over the next couple of days.
Some living in the 10 confirmed hotspots support the move.
If that's what needs to be done to keep us safe, then I'm okay with that.
The sooner we can get all this virus gone, the better.
I think it might be necessary.
New South Wales has recorded 7 new cases, while South Australia has recorded 3 new cases from returned travellers.
The good news is, though, that all of these people are in quarantine at the hotel in Adelaide.
Health authorities warning young people to take the COVID message seriously, with a third of new cases from community transmission aged in their 20s and 30s.
And SBS reporter Abby Dinham joins us now live from Melbourne. Abby, good evening. What's the latest response tonight to the crisis in Victoria?
Well, Janice, we knew that requesting additional ADF support was an option, and tonight 70 medically trained ADF personnel have landed in Melbourne. They'll be deployed to 5 designated testing sites from tomorrow, with the focus still very much on those hotspots, those 10 COVID hotspots that we've been hearing about. Overwhelmingly, the new cases in Melbourne have been identified in Melbourne's northern and western suburbs. The health authorities say as they consider any sort of suburban lockdown, they first need to consider the logistics of how they could police such a measure. Their fear is that a suburban-wide lockdown could, people who don't want to comply with it, they could simply pick up and move to another suburb while the lockdown is in place. So before they consider any sort of measure like that, first they need to figure out how they're going to police it. And we don't know at this stage, Janice, if the ADF could be a part of that, but in coming days we should find out.
We look forward to the update. That is Abby Dinham updating us there from Melbourne.